Hey there, Dr. Jason Kim here, New York Dental Solutions. Thank you for joining our YouTube channel. And today I'm going to talk about a day in the life of a dentist, a day in the life of Dr. Jason Kim's world. So I get asked, what type of procedures or what type of patients are your quote unquote worst types of patients? There really is no worst type of patient or a patient that we don't like, but the patient that doesn't follow your instructions, it can be a little annoying because you're trying to provide the best care for your patients. And particularly if you tell patients, especially something after like you take a tooth out, you tell them to go home, don't smoke, don't drink alcohol, don't rinse. Those are very important instructions, and we tell you that for a reason. But many times we'll have patients who will, after we take the teeth out, they go out the door. What do? They start smoking. And they don't think we're seeing, but we can see them. Why? Because we have cameras. So we have cameras that see them, and the second they go out, they start smoking. Smoke is not good for the healing after you take teeth out. And that's why we tell patients, don't smoke. Don't drink anything through a straw, right? Because that's going to help delay healing. And so there's a reason we tell patients those instructions. And when they don't follow those instructions, it's uncomfortable because we know that it's not going to heal well. And so we want the procedures to go well, but if the patients don't listen and they don't follow the instructions, it makes our job more difficult, but it also has effects on the patient because the healing is not going to be quite good. And so we want the best results for our patients. Another type of patient that we have difficulties with is maybe patients with a lot of saliva. You may think that's funny, right? But patients with a lot of saliva, a lot of times the procedures that we do, sometimes it has to be a dry environment. And if you have a lot of saliva, it's hard to really get in there and really make sure that keep it dry. For example, if we're bonding veneers, if we're doing some fillings, we have to keep a dry environment. And if a patient has a lot of saliva, we have to try and keep that environment very, very dry. So we'll suction, we'll put gauze, and it may be a little tedious. Patients may be a little uncomfortable, but we have to do what we have to do. We have to do those things to be able to provide the best possible result, because that's what's going to give us the long-term successful results, keeping the areas dry in cases of bonding, fillings, and so forth. And so patients who have a lot of saliva, right, it may be a little tough and challenging, but we manage and we get it done. And so those are just a couple examples of a day in the life of a dentist, right? What we go through in terms of difficult procedures or difficult patients. So hopefully that kind of changes up things a little bit in terms of content for YouTube, but those are the realities of what we do. So thanks for joining us. Thanks for subscribing. We'll see you again soon.